Hello, everyone. I know this today's been probably a lot of heavy conversation, and I wanted to say that there's I have two sisters in the medical community. I have much respect for, and one of my good friends from grade school and high school is a doctor, and there's a lot of wonderful people in the medical community, and this is we're going to talk. Especially what happened to my daughter. It talks about some things that are heavy, and there's always improvements that can be made. But I just wanted to also say that there's been a lot of good things that have happened, and I feel just like I wanted to mention that, and I'll share a little bit about that about my daughter as well. Some of the good things that happened to her, medically speaking, before she passed. But I want to tell you a story about Emily first. Emily was born 13 weeks early. She was 2 pounds and 1 ounce, and she ended up getting cerebral palsy because of that, being premature. She was amazingly, even though she was wheelchair bound, she was an amazing human being. Had an incredible sense of humor and loved the Food Network and Rachel Ray, and it was an absolute pistol and did things that made me laugh all the time. All the time. One of the most funny people I ever met. So she, like many people who have cerebral palsy in a wheelchair, her spine started to curve dramatically during puberty. And it was bad. It was a bad curve. And so she had to get spinal stenosis. Otherwise, Emily, relatively speaking, considering her condition, was in pretty good health. And the reason why we decided to get the surgery was to improve her quality of life as she was becoming a teenager, so that she could sit straight up and enjoy her 20s and 30s, and maybe live into her 40s or something of that nature. Is that's what the plan was, and we had every reason to believe that would be the case. Emily went in for surgery on a Tuesday, May 5th, 2015, and she, at first, the surgery went well. It was labeled as a successful surgery, and we were told if everything went perfect, she'd be home in a week. A lot of people sometimes come home in 2 weeks or 3 weeks or even 4. But so everything was going as planned. So we did have one setback where she was having trouble eating food, and they said that can happen too sometimes with all the change in your digestive tract by your spine being dramatically moved. All kinds of organs are being replaced in the body, and so she was there for 8 days until the first time she had a fever that we noticed was unusual. Actually, we didn't know at the time she had a fever. It was logged down in a computer at the hospital, but no one told us. So then we got further along in the process. She was put on TPN, which is she was being fed through her veins. And being that she had cerebral palsy, and was not able to go into a bathroom, especially considering the nature of the surgery. She was in a diaper, so I think there's some added risk there of infections. And she then on a Saturday, she had developed a huge fever. This was day 11 in the hospital. And this is the story I really want to tell you about, is that what happened on day 11. It was Saturday. She got a fever in the morning, and it kept on, and the fever kept on spiking up. Her heart rate was like was incredible. It was started off at all of a sudden it's at 120. And then the nurses come in, and the thing keeps beeping, and I think eventually they changed the setting. They gave her some painkiller and some Tylenol and things like that. Next thing you know, it's 130, 140, 150, 160, 170, 180, okay? So they're thinking, well, maybe there's an infection. Okay, maybe there is. I don't know how serious, I didn't know what that meant personally. She did have a central line, which is a danger. And I learned all these things after the fact, by the way, all the risks that she had for sepsis. So the doctor ordered to take blood out of the central line and to do a test on that blood. So one thing I know, just to go back a little bit, they tried to take blood out of that central line. I don't know exactly how many days before, maybe 4 days before, 5 days before, somewhere in that range, and they couldn't get it out. So I just wanted to share that. Even though things could go into the central line, like medications, they couldn't get blood out. So that could have been a sign that something wasn't right with that central line. So when the doctor ordered to get the blood out of the central line to do a test, they came in, couldn't get the blood out. They tell the doctor, and the doctor orders, I think it's called TPA, and that is when they try to clear the clogged line, central line. So it's a couple hours, maybe a couple hours go by. Some nurses come in and they try to clear it with TPA. They give it a certain amount of time. A couple hours later, a certain period of time to see if it works. And they still can't get blood out of the central line. They tell the doctor. Doctor, a couple hours later, orders more TPA put in the line. So now we're getting, a lot of time starting to go by the way, here. And she's got a bad fever. And her heart is racing like crazy. I don't know what the blood pressure results were at the time. Honestly, I didn't know how important it was at the time because I was uneducated at all about sepsis. So, and I didn't know what kind of urine outfit she was having, by the way. So that turned out to be something probably, these are the kinds of questions I would ask today. And so they tried the TPA again. Didn't work. They couldn't get blood out of the central line. And finally, I would say about 14, 15 hours later, 2 a.m, my daughter's groaning in pain in her bedroom at the age of 14. And that someone finally had the idea, well, why don't we just take blood from her arm? It's ingenious. I'm sorry to be negative about that, but that's what has to be done right off the bat. In fact, there's a few things that could have been done right off the bat, but they could have conceivably just assumed sepsis and just gave her some antibiotics right off the bat and wait for the culture to grow. That wouldn't have been a bad move. And considering all the circumstances. And they now have a new protocol at the hospital to do such a thing when someone has a central line. So Emily, my wife was looking on her cell phone and she looked and she said, maybe Emily has sepsis. I didn't even know what she was talking about. And I'm like, my wife's lost it. She's looking at this stuff online again. I hate it when she does this. So, and I say, okay, fine. Let's call the doctor in. I didn't really want to do it, but I did it. And I said, the doctor, could she have sepsis? And he goes, no, that's why we're giving her antibiotics. After they realized that she did have an infection and that she had gram-negative rods. That's why we're giving her antibiotics. She doesn't have sepsis. And I'm thinking, when I learned everything after the fact, by the way, I'm thinking, of course she had sepsis. She had gram-negative rods that grew. And so we thought she was sleeping throughout most of Sunday, but she wasn't sleeping. She was in a coma. And I kind of thought something wasn't right, and I was nervous, and I didn't scream at the top of my lungs. I felt like I should have now that I know what I know, but I would just say that whenever you have a feeling that something doesn't seem right, it's okay to express that concern to people, that something does not seem right. Because she was sleeping all day on Sunday, but we thought that she was in so much pain the day before that maybe she was just resting because of how painful it was to go through it. She went through the day before. Now she's on antibiotics. Everything's going to be fine. Within 30 minutes of the doctor saying she doesn't have sepsis, I go for a walk because I'm nervous. My wife's with Emily, and all of a sudden the nurse gets on the intercom. She says, "Your daughter okay?" And she goes, "Yeah." And then all of a sudden, she's looking up at the thing, and it's showing her blood oxygen level going down. So they call the doctor in, they put oxygen on Emily, and within a couple minutes, she's coded. So we found out later on that night, or it might even have been the next morning, that Emily had sepsis after all. And we found out she had sepsis by her coding in a hospital after a major surgery. It was, and I've heard many cases about sepsis, none of them quite like this one, where someone was in the hospital the whole time. But there's a lot to be learned about this case, and what upsets me, I could say I'm upset. How did Emily get E. coli in her system? You know, and part of me isn't that upset about that, because I think to myself, okay, people make mistakes. Somehow, I could have been the one that didn't wash my hands. It could have been anybody. Somehow, E. coli got in her bloodstream. But what really upsets me more so is not that she got it in her bloodstream, is that there was not an immediate sense of urgency to get the blood out of her arm, get it tested, and possibly even seriously consider start giving her the broad spectrum of antibiotics before you wait for the results for the blood culture to grow. Because of how, you know, sepsis is blood poisoning, it's an infection in your blood, and if it's not treated, 100% of people will die if it's not treated. It's, you know, if you have full-blown sepsis that goes to, if you start going into septic shock, it's a serious ailment. So there needs to be a lot of education about sepsis, not just from lay people to be able to say, is this sepsis to medical professionals? But even the medical professionals might need some training to make sure they know what to look for. The nurse who was watching our daughter that weekend, they were doing 12-hour shifts because it was the weekend. Very young nurse, probably only 2 years out of school. I don't blame her necessarily. There's all kinds of people that missed it. Even the doctor who was the hospitalist had 15 years of experience. But what exactly happened and how a lot of different people had to miss it in order for Emily to get into the condition she was without anyone knowing she had sepsis. And this was not a small hospital. This is a big children's hospital she was at. Emily was saved by doctors when she was born and by the medical community. I mean, modern medicine saved her life. Emily's had many surgeries before that all went off without a hitch to allow her arms and her adductors and everything to be stretched out as she was growing like a weed in early puberty. So there was lots of good things that happened from the medical profession that allowed Emily to have a good young life as she was growing into her teen years. I worked for the Rory Staunton Foundation as a volunteer. They lost their son Rory, who was just playing basketball, and he fell and got a cut and got sepsis from a cut. They went to the ER, and no one thought anything of it. The fact that he was puking and felt absolutely terrible. And there's tests you can do. They get to do blood work to make sure, you know, that to rule out sepsis. Any infection can really technically turn into sepsis. Any infection. You can get sepsis if you have a kidney stone that doesn't pass. You can get sepsis from the flu. Any infection can turn septic if things just don't go right. So it's a question that just has to be asked. Could this be sepsis? And the Rory Staunton Foundation, what they accomplished in their home state, because Rory lived in New York City, is the state of New York has mandatory sepsis protocols. And that's what we advocate for, so that there's just protocols we want protocols in every state in the United States. The state of Illinois now has sepsis protocols. This family, the Gallo family, lost their beautiful daughter Gabby, just like the Staunton family lost their beautiful son Rory. And and I lost my beautiful daughter Emily. These stories, we're hoping that we can get each state individually to have mandatory sepsis protocols, so that it takes the human factor out of it. Doctors can have a bad day, nurses can have a bad day, but if the protocol says if someone exhibits these 3 symptoms, you have to do this, or these two symptoms, you have to do that. It takes out some of those human flaw factors. And so I really am a big advocate of mandatory sepsis protocols in all states, and for the anything we can do to have a double check system to take out the human error factor when these kinds of things come up. And in the case of Rory Staunton and Gabby Orla Staunton and Kieran Staunton are the parents, and Gabby's parents, they were big advocates for their daughter and getting laws passed in Illinois. Pennsylvania, we're trying, and there's a lot of other states that are trying, Massachusetts, New Jersey, and many others. And so that's what that's really what we want to see happen. I will share a couple quick slides here. The mission is to reduce the number of sepsis deaths at the Rory Staunton Foundation. I'm part of the National Family Council on Sepsis, and it's specifically about families talking about sharing, going to the state they live in. Because if you're a constituent of that state, it's easier to go to your congressman and say, not your local congressman, your local state senator, not federal, or your governor or your state Department of Health, and say, I want these protocols. Because you're one of them. I'm a Pennsylvanian, and so we want a rapid diagnosis. No, the protocol is not just to treat, but to diagnose. And the National Family Council is to do just that. And we actually have a meeting coming up on Monday to talk about there's a lot of people that want to help, that have lost loved ones or survivors that luckily survived, even though that they were turned away from hospitals when they first arrived. So this gives you the idea of this map here. The states that have mandatory protocols are in green. The orange we're in stages of discussing it, and then in blue, we're in the early stages of requesting mandatory protocols. So that's all I have, but I wanted to, I'm not here to, I know I can't bring Emily back, but I hope that, and I think we have saved at least one life, and if we save just one life or just from happening to one family, then our efforts are successful. And we think we've done that, and hopefully it'll be a lot more. Thank you for listening.